Your objective in the station is to physically demonstrate the assessment and management of a medical patient. You're being evaluated individually on the skill, but you have an imaginary partner who works under your direction. At the appropriate times, please describe to me those procedures that you would delegate to your partner. You may assume you have any needed equipment. For each assessment section, I'll read you a brief patient scenario, and during the assessment, I will answer any questions you would normally ask your patient. Remember, this is a practical exam, and you must physically perform the assessment. Do not assume that I can see what you were doing. Briefly tell me what you were doing as you do it. You have 15 minutes to complete each assessment. You'll be stopped at 15 minutes and evaluated on your performance to that point. Please let me know when you're ready to start.
Ready, sir.
Okay. So you respond to the supermarket for a produce guy in the back who's complaining of shortness of breath.
Okay. Seat safety assigned.
Okay.
Okay, so I have one patient, and nature she said shortness of breath.
Shortness of breath.
Okay. So at this time we'll start our assessment for determining additional resources, the need for, and we will activate ALS. So as I walk towards my patient, general impression, how do I find my patient sitting, position?
As you approach your patient, you find your patient sitting in the back where the produce storage is. There are grapes all over the counter. He's sitting in a chair, breathing fast in a tripod position, and as you approach, you hear audible stridor.
Audible stridor upon approach. Okay. So this time I'm going to approach my patient. I'm going to introduce myself. Hi, sir. How are you doing today? My name's Joe with ABC Ambulance. You okay if I try to help you out?
Yes.
Okay. What seems to be going on?
He tells you he can't breathe and he feels kind of itchy.
Can't breathe, feels kind of itchy. So as I do that airway assessment, do I notice any cyanosis around the mouth and nose? Do I notice any angioedema or swelling?
You don't notice any cyanosis, but you notice that his lips are a little swollen.
Lips are a little bit swollen, okay. And if I have him stick out his tongue, is there any swelling to the tongue?
It looks a little swollen.
Looks a little swollen. So we've got some swelling to the airway, so I'm certainly concerned, and we've got that audible stridor. So I want to immediately come in. I'm going to have my partner start to get me a baseline set of vital, pull out the oxygen. We'll get them set up on non-rebreather. I'm going to listen to lung sound, so I'm going to have them sit forward. As I listen over an inspiratory and expiratory, I have the audible stridor. What do I hear in the lungs?
You hear wheezes in all fields.
Wheezes in all fields. Okay. And you said I have some accessory muscle use?
Yes.
Okay. So this time we're going to administer oxygen therapy. We're going to put our patient on a non-rebreather, 15 liters per minute. Does my patient accept the intervention?
He does.
Okay. So we've done our airway and breathing assessment. I'm going to want to do a quick circulatory check. So I'm checking my pulses.
He has pulses. They're rapid and weak.
Rapid and weak. And as I'm touching the patient, what are those skin vitals?
Skin is pale, cool, and diaphoretic.
Pale, cool, diaphoretic, and there's no obvious signs of bleeding?
No.
Okay. If I do a quick check, sir, are you okay if I just kind of look under your shirt? I just want to see, do I notice any urticaria, any hives in the back?
You do notice he's got some hives across his back and a rash across his chest and upper neck.
Okay. So he's got the stridor, the urticaria, he's got swelling to the airway. I'm thinking that this is an anaphylactic event. So we've got him on the oxygen therapy, and my partner's getting me my baseline set of vitals. So, sir, what were you doing when this happened?
Packaging grapes.
Packaging grapes, okay. And does anything make this better or worse?
Nothing seems to make it better. It's getting worse really quickly.
Okay. And you said that you with this shortness of breath. So on a scale of 1 to 10, 1 being no trouble breathing, 10 being not being able to breathe at all, where do we fall on that severity?
This is about an 8.
About an 8. Okay, so pretty high up there. And at this time, how long has this been going on?
About 25 minutes.
About 25 minutes at this time. Okay. So itchy, shortness of breath. Do you have any other pain or discomfort anywhere, sir?
I'm really itchy all over, and I think I got bitten on the hand. My hand really hurts.
Okay, so I'm going to take a look at the hand. So as I examine, do I notice any bite marks, swelling?
You notice a bite mark and a little bit of swelling to that hand.
Okay. Do I notice any type of stinger or anything in there?
No.
Nothing at that point. Okay, so it looks like this was, the route of injection here. So we're going to keep an eye on that hand and that swelling, and at this time, my partner should have my baseline set of vitals.
Okay. The patient has a blood pressure of 140 over 80. He's got a heart rate of 128. Respiratory rate is 28.
Okay. Sir, are you allergic to anything?
Tells you he's allergic to bees and spiders.
Bees and spiders. Do you think he might have been bit by a bee or a spider here in the hand?
He tells you anything's possible. There's all kinds of bugs in the fruit.
Sure thing. Okay. So do you have any medical conditions?
Other than the history of Of
the allergy?
the allergies, no.
Okay. And so do you take any medications? Have you been prescribed an EpiPen?
He has an EpiPen.
You have an EpiPen? Okay. And have you ever taken that EpiPen before, sir?
No.
No, you haven't. Okay. And last oral intake, last time you ate today, sir?
He had a break about an hour ago.
Break about an hour ago. We said that this has been going on about 25 minutes.
Yeah.
So at this time, we've got our vital signs. I believe my patient's having an anaphylactic reaction to potentially a spider bite that might have been in the produce. So at this time, what we want to do is we want to administer epinephrine. So we have an auto pen that is a standing order for us to administer to the patient. So I want to check these 5 rights. I have the right patient. The right medication is epinephrine. We're going to give 0.3 milligrams for an adult dose. The route is going to be intramuscular. We're going to go in the lateral aspect of the thigh. And this is the right time because I think they're having an anaphylactic event. So I want to explain to my patient our course of treatment. So, sir, I think you have an anaphylactic event, that allergy with the itchy and the trouble breathing. What I want to do is give you this medication, epinephrine, okay? So it's a needle that's going to go in your thigh. So we're going to administer this to you. You feel a big pinch when it goes in, but this medication is going to help open up your airway so that you can breathe a little bit better, so we can try to get that under control for you, okay? You okay if we administer this?
Yes.
Okay. So this time we have the epinephrine. We removed the cap. We're going to make sure that there's nothing on the side. We can go right through the pants. We're going in at a 90-degree angle. We're going to hold this here for 10 seconds. 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. We're going to carefully remove this, put it in a Sharps container, gently massage the area to help disperse the medication. And at this time, we want to start packaging the patient to get them on the way to the hospital. When we've got them in the back of the ambulance, I want to reassess. So we just gave this epinephrine, hoping that it's going to help this airway. Do I notice any change in the stridor or the accessory muscle use and the ease of breathing?
The stridor is gone. There's less accessory muscle use. He seems to be breathing easier, and he looks more comfortable.
Okay. So, sir, on that breathing scale, you told me it was an 8 out of 10, 1 being no trouble breathing, 10 being the worst ever. Where would you rate this breathing problem now?
About a 3.
About a 3. Okay, so we've got some good relief for you. So at this time, we're going to continue to transport the patient on our oxygen therapy, high flow oxygen. We could re-administer this EpiPen, 0.3 milligrams a second dose. We'd wait, 5 minutes. If we weren't having the relief or we started to see the patient getting worse again, we would re-administer this one in the other leg. And we will continue to transport this patient, high priority, reassessing our interventions and our vital signs every 5 minutes until we arrive at the hospital, where we'll transfer care to an equal or higher healthcare provider.